Welcome everybody to Next Level Interview with Jason Douglas. I am thrilled to be here. My name is Matthew Rahm, physical therapist. I have Jason Douglas up here, who is virtual all the way from Calgary, Canada, when we are so pleased to have him with us today. I'm so excited to have this. But Jason, why don't you talk to me a little bit about, well, first of all, let's introduce yourself to the people who don't know who you are. Tell us a little bit about yourself and how long you've been a therapist and stuff.
Sure, sounds good. Yeah, thanks for having me on, Matthew. This is pretty cool. I did graduate from the University of Alberta back in 2011, which means I've been working for 14 years now. Feels time kind of flies when you're, I guess, busy. I've always worked in private practice. I opened a multidisciplinary clinic, Momentum Health West Springs, back in 2014. So after I was working a couple years. We work alongside chiropractors, massage therapists, kinesiologists, nutritionists, acupuncturists, and the last couple of years we have a physiatrist as well. So it's a pretty big mixed clinical bag, but it's awesome for our clients to be able to refer and hand off as needed. For my background, I started working with EIM back in 2017 as an assistant instructor, and then moved into the lead role kind of during COVID in 2020, actually. Partially, it was just kind of hard to get the instructors up from America, so I had to step up and keep it moving in Canada. So glad I was able to fill that role. Myself, clinically, I work with a variety of clients. I have a special interest in treating spinal clients, both neck and lower back, as well as jaw and TMJ dysfunction, both of which I prioritize a lot of our functional dry needling approach that we teach with the IM. Really, really effective, I find, for these clients. And a lot of times, I think I would be at a loss for some of them if I didn't have this option, to be honest. Also, on the fun side, I do treat a lot of pro athletes. So I have one or two fighters that fight in the UFC, some professional boxers, and some high-level collegiate golfers, actually, and are actually high-level gymnasts as well. So that population is pretty fun to work with. Again, working in dry needling when I can, when appropriate, but they also respond really, really well. And for anybody watching this that uses needling with athletes, they usually find that it's a pretty effective tool for that population as well.
Yeah, that's awesome. You get to work with kind of a big spectrum there with athletes to everyday people, and it's great to see that. For myself, I've used it. It's been helpful also. So what inspired you to kind of specialize into the dry needling? You have this, practice you've been building up and stuff, but talk to me about how you specialized and how you thought about specializing into dry needling, how that shaped your approach to you see patients with now.
Yeah, for sure. My first probably visualization into dry needling was when I saw it as a client. It was when I was in undergrad. I took a Bachelor of Physical Education up in Alberta as well, and had a back injury that from lifting, probably wrong, trying to go too hard on the deadlift, as everybody does. That just wasn't getting better. And saw a couple physios, chiros, didn't really get anywhere. And then I did see a physio that offered dry needling, and I just remember thinking like I was like 95% better in a day is what it felt like. Anyways, obviously I still did do a lot of rehab, but just the impact it made, I knew I really liked that, and to feel that the change could be so immediate was something I hadn't really had before. So I knew that was something I wanted going forward. And then with my practice, bringing it forward, I like to offer it to clients. Some clients want to do it on day one. Some are more hesitant, but I was like, what I like is to be able to give them the option, because a lot of people look for it now. It's becoming more popular. So we get a lot of people calling the clinic. I would say in my clinical practice, we have 6 physios now and 1 pelvic health. And of all the bookings we get, probably 30 to 40% are requesting dry needling on the assessment when they call in. So if we didn't have clinicians that were able to offer that, I think we would lose a lot of clientele base nowadays.
Okay, great. So how are you incorporating this, dry needling into your spinal patients or your chronic pain patients to enhance their treatments? What are you figuring out what works out well there? And how do you know what clinicians should take and using these tools take that to that next level?
Yeah, I mean, obviously, as you know, spinal injuries and chronic pain are both complex, kind of multifaceted conditions that we as clinicians, it's helpful to have basically as many tools in your toolbox as you can, which I know we say all the time, but it really is true. Some patients will respond really well to needling. Some from previous fears don't want it, which is totally fine. It's just another tool we can implement. But oftentimes, especially in the chronic pain patients, I find they do really well with it, but I kind of keep it in the mindset of less is more. So when those patients are really ramped up and they're already in a lot of pain, I want to just do as little as I can to make a change, do maybe 2 needle points, get them to see that they can move better, have less pain when they do my exercises. And then maybe the next day we go a little bit more. So it's kind of like a ramp. I just build them into it a little bit better, and that's been working very, very well. With the spinal patients, the nice thing in my clinic being multidisciplinary as well is I co-treat a lot with our chiropractor. So I have a lot of patients with spinal pain that I will needle first, generally the deeper layer of multifidus, anywhere into the spine. And then after our treatment and our rehab exercises, those patients that are appropriate go down the hall, see our chiro, get adjusted, and one, do better, combining both, but also two, the chiro reports to me often that they have to do much less aggressive adjustments when the musculature isn't in so much tone. So whether it's you as a physio doing the adjustments or the chiro, it is so much easier.
Yeah, and for those who are in the States, again, the little different healthcare system up in Canada, with sometimes just how therapists are able to do manual therapy and the training and stuff. So it's a little different, but I would firmly agree with you that sometimes you needle them first, then it's like the amount of force that sometimes is even needed is like, oh, it just kind of goes and stuff. So
Totally.
great, powerful too. So do you have any really good powerful patient success stories where you've done the dry needling and you've seen like wow, this made a huge impact, it really turned that, and how the education you've received and that you're providing for people has really helped ratchet up that next level thinking?
Yeah, for sure. Actually, one client that I had recently in the last 6 months or so was interesting. It was a TMJ type pain patient. He just was at a normal routine dental procedure, getting a cleaning or something, and obviously had your mouth open for, I don't know, 10, 20 minutes. And after that, just got intense single-sided jaw pain that would not resolve. He was back to that dentist a few times, and they just couldn't figure it out. It looked fine on X-ray, etc. Luckily, this was a dentist that I started working with the year before as a client. He came to see me as a client for something. I was treating him. He liked it. So I told him that I did specialize a lot with TMJ and spinal issues. And he asked if I would come into his dental clinic and do a presentation. So I did a presentation there, just talked to him and the hygienist about what it looks like when patients may present with jaw pain, but it might be more physio related, how we can co-treat together. This patient fit the bill specifically because they were having unresolving lateral TMJ pain, and they had a loss unilateral in neck rotation. So one side they could rotate fully, but the ipsilateral side of their jaw pain was like 50% for no mechanism. It just wasn't going. Obviously, the dentist doesn't look at that, but that's something that I can. So when they saw that and did the screening that I taught them, they sent this guy over, and yeah, it was a very, very tight suboccipital musculature and lateral pterygoid that, again, without needling, those muscles aren't impossible to get, but they're pretty hard to get.
Yeah.
So I was able to access that, and it didn't go away overnight. It wasn't proved, but probably 4 sessions, and he was back to 100%, which is amazing. Because yeah, otherwise they were actually considering doing a root canal. So I'm glad to say he got to keep all his teeth. So yeah.
Well, that's very impressive, and especially when you help those people, like you said, that prevent them from getting those, or unfortunately sometimes you see the other ones, I'm sure also, that have had teeth extracted because of a pain, and then like, I'm sorry, this was a masseter, a temporalis that had a trigger point, and those
Yeah.
some of those
And
classic referred pain patterns.
there's no going back once you go down that road. So
No, it's really quite sad and stuff. So what would you say, people who are taking the EIM functional dry needling course from you or the others, what should they expect by coming to that class? What should they learn, or what should they feel like they can walk out of with day one?
our learners can expect a very directed, hands-on educational weekend as we instructors really focus on making sure the students are prepared for Monday. We really want them to know what to do and how to do it safely as soon as they're with their patients next week. Um, one of the most important things with EIM and the way that we teach functional dry needling is we definitely prioritize safety. We want you to be effective, to be skilled, to be competent, but safety is always number one. So the way that we teach it has been studied to be the safest way. For example, an upper trap needle can be done one of 7 different ways, but the way that we teach was actually developed under ultrasound of how close the needle is in proximity to the pleural cavity and the lung fields. So we can show someone this is the safest way to do it. You do it this way, you're not going to have issues, and you'll be very confident with your clients, so you'll know you're in good hands.
What, you don't want to create a pneumothorax?
I mean, not on your first week, anyways. Yeah.
Nah, that's not probably not a good thing. So with your experience in the PT space here, what is one essential tool or technique that you believe that every PT should have in their toolkit, and why?
I mean, the easy answer, of course, based on this conversation, would be needling, and that is still an answer. But I think probably the number one thing is empathy and just being able to connect to people. I think sometimes we get really busy and kind of forget that it's a person in front of you and need to be able to connect with them and what they're here for physio for. The nice thing with needling is it fits that empathetic connection quite well, because usually what people want, or almost always, is to get better quickly and get back to doing what they love, which is what needling can help you do. So once you made that connection and can show them this tool that can get them back what they want sooner, you're going to find a world of difference with your clients, and they will appreciate you for it.
So I just have one final question that I have for you. Once you've started using these techniques, would you say that you've started getting tougher patients now?
Yeah, to a degree, somewhat, because you start to get a lot of referrals. So you help someone, which is great, but all of a sudden then their aunt's cousin friend that has a back injury that's seen 5 people is also going to come see you, which is good because you'll be prepared for it. You can handle it. But yeah, you'll get some harder clients, but you'll get some more interesting clients. You get a lot of fun clients. You get the athletic clients. I think it's good to have a mix like that. Yeah, for sure.
Well, that's good for self-referral, getting your patient population and getting people who really support what you're doing. So this has been awesome.
Totally.
Jason, I am so excited for what you're doing and what you're doing with EIM and the functional dry needling. It is awesome to see therapists with those skill sets and you out there teaching them. So thank you again for your time for this next level interview with me. I really appreciate it. So with that, have a awesome rest of your day.
Thanks a lot, Matt. You as well.
Thanks. Bye-bye.